risk for intestinal cancer is in terms of lifestyle. Patients who are obese, patients who eat a lot of fatty food, patients who eat a lot of preserved and canned foods, patients who are smoking, chronic smokers, chronic alcoholics. So these group of patients are at risk of colon cancer. But in addition to these regular lifestyle risks like obesity, smoking and alcohol, colon cancer is very strongly positive in patients with a family history. So if your father or mother or any of your first degree relatives, your uncle, blood relatives, blood first degree relatives have had colon cancer, you're at a much higher risk, because colon cancers occur due to mutations inside in your large intestine, which are transmitted from family member to family member, and patients who have a risk of family history of colon cancer are at risk of developing colon cancer. So this risk is not just in patients with a family history of colon cancer. There is hereditary non-polyposis colon cancer. This is like a Lynch syndrome, we call it, in which patients with not just colon cancer but family history of other intestinal cancer, family history of stomach cancer, family history of endometrial cancer, family history of ovarian cancer. So if any of your family members have these group of cancers like ovarian, endometrial, stomach, large bowel, small bowel cancer, then you are at a risk of colon cancer. So all these patients starting from 50 years of age, you should have every 5 years you should have a colonoscopy checkup done to rule out colon cancer. So in addition, there are some other groups of patients who have some diseases like ulcerative colitis and Crohn's disease and polyposis coli. They are specialized conditions. Patients usually go to a doctor with bleeding in stools and increased stool frequency. When the doctors diagnose conditions like polyposis coli and ulcerative colitis, these patients are at a risk of colon cancer.